Okay, I'm just continuing this, like, I don't even know what it is, online diary documentation of what is happening with Oli for awareness. I just watched that back. The word is for. That is my Midwest accent coming through. Not fur, for. Information. I didn't give any lipids with her TPN for, let's see, from the 18th to the 21st. And I'll show you pictures of, this is Tuesday, this was Wednesday, this was Thursday, this is Friday before I started the TPN, and this is Friday night after I started the TPN with the lipids again. Now, the GI doctor did agree to switch over from intralipids to something called lipids, which is supposed to be like more hypoallergenic as well as less causing less inflammation. However, this is before, this is after, and she reacted really fast. I mean, it was less than an hour. Usually it takes 2 hours for her to have a reaction, but this was less than an hour. I gave Benadryl, and it took almost 2 hours for the flushing to get better. And then you could tell she just felt like garbage again, which is really unfortunate because the last, let's see, Tuesday, Wednesday, Thursday, and Friday, she's been really, really good, like up and playing and awake. And she takes a little tiny nap in the morning, but all day she's going, raring to go. And then last night, she was done. Yeah, she was done. Now, given Benadryl obviously does make you more tired, but it's like more than that. It's like this morning, now she's up and, she got up this morning and then immediately wanted to go right back to sleep. And she's been sleeping for a couple of hours now. So it's like it makes that chronic fatigue even worse. And so, once again, I think this leads us back to a mast cell activation. Like, that's all I can, that's the only thing that makes sense. Like, all of these symptoms, all of these weird symptoms. And I get that it's not something that a lot of doctors are familiar with. Um, but I just keep sending pictures and pictures and pictures showing them. And unfortunately, now that we've switched to this type of lipids, there's lipids in every single bag. Where before she was only getting lipids 4 days a week because her triglyceride levels are high. They said with this type of lipids, because of, I don't even know, they don't want her to have a fatty acid deficiency, it has to be every day. So now I don't know what to do. And of course, it's the weekend. I did talk to the dietitian before starting this on Friday, and they're always super nice on the phone. And they're like, oh, just call us and let us know if there's any problems. And, well, maybe we can try something different. And I get that same response in person. But then when it actually comes down to trying something, it's not the same. They're like, no, no. Again, the same. It's not the CPN. It's not the lipids. But good news, I did get her in with a doctor in Florida named Dr. Trevino. Actually, we're seeing his PA because he was booked out to the end of July. We're seeing his PA in May. He's supposed to be like the best in the South. Like, he deals with POTS, mast cell, like a lot of autoimmune, dysautonomia symptoms, and it's a telehealth. It's an hour long. So we have that appointment scheduled. I also made another appointment on May 2nd with a clinic in Dallas that's also telehealth that also deals with the same type of, mast cells, POTS, dysautonomia, autoimmune stuff. So maybe we'll get somewhere with something somehow. There's another GI doctor that was recommended to me, but they don't take pediatric patients. But she'll be an adult in like a month and a half. So we're just going to have to wait it out. My fear is that if it is mast cell, it's just going to get worse. Right? I did get an EpiPen ordered, so I have that at home. Everyone knows how to use it. And I guess we're just going to keep researching. I joined a bunch of Facebook groups about mast cell activation syndrome and dysautonomia. I'm listening to an audiobook right now about, I think it's from 2016. Like there was very little. People were just starting to recognize what this was, or this was something, because there were so many patients with all this weird symptoms and allergies and this chronic fatigue. And I would say the chronic fatigue is probably her biggest problem. From what I can tell, I mean, she's nonverbal, so I don't know how is she dizzy? I'm sure she's dizzy because sometimes she falls, she tips over. I know she has like low blood pressure. She gets the racing heart palpitations. But the chronic fatigue, watching her sleep her life away, is what's the most heartbreaking. And I just cannot seem to convey that to the doctors. I'm just hoping that one of these doctors is going to listen and treat her like any other patient. Like, look beyond her disabilities, look beyond her being blind, look beyond her being nonverbal, look beyond all of that. Look at her as a 17-year-old young lady who is trying to live her life and at this point is unable to enjoy any of her normal. We literally can't go anywhere. We are stuck in the house. She doesn't have the energy to do any. I mean, just going to a doctor appointment is absolutely debilitating for like at least the rest of the day and usually into the next day. Like she's that tired. Just a waiting game. We just continue to wait and research and document and read and obsess some more and obsess some more, because that's what I do these days is I obsess about Oli and trying to figure out how to help her, because that's what we do, right? We just try to make the best. We do everything we can do. I do everything I can do. I will do whatever. I just want to help her. I just want to help my kid. I want to stop driving the bus. I want someone else to take over driving the bus for me. We'll see if that happens.